Hi there and welcome back. Let's continue with Ectopia lentis syndrome. We'll get into the characteristics, the statistics available, causes, diagnosis, treatment, and bottom line underwriting. In some families, dislocation of the lenses of the eye, called ectopia lentis, is the predominant feature that passes from generation to generation. Sometimes this occurs along with some of the skeletal, bone or joint features of Marfan syndrome. This combination of features is called ectopia lentis syndrome, also known as familial ectopia lentis. The typical characteristics include increased pressure in the eye, glaucoma or retinal detachment, nearsightedness or myopia, fluctuating or blurred vision, variable skin and skeletal manifestations that are also found in Marfan syndrome. As far as the statistics are concerned, much less common than Marfan syndrome. There aren't any good estimates regarding the frequency of this condition in the general population. Genetic testing is available for both dominant and recessive ectopia lentis syndrome. The most common cause of ectopia lentis syndrome is a change in the FBN1 fibrillin 1 gene, the same gene that causes Marfan syndrome. In some families, ectopia lentis is passed down as a dominant trait. That is, a child only needs to inherit a single abnormal copy of the gene from an affected parent to have the condition. Less commonly, ectopia lentis syndrome can be inherited as a recessive trait, that is, a child needs to inherit an abnormal copy of the defective gene from both parents. In these circumstances, the parents are unaffected because each has one normal copy of the gene in question. Recessive ectopia lentis is not associated with a risk for vascular disease. Two genes have been associated with recessive familial ectopia lentis syndrome. They are ADAMTSL4 and LTBP2. An ophthalmologist can often distinguish between dominant and recessive ectopia lentis based upon family history and physical findings. How do we diagnose? The diagnosis of ectopia lentis syndrome is made up by an ophthalmologist using a slit lamp exam. Anyone suspected of having dominant ectopia lentis syndrome should have a comprehensive evaluation by a geneticist and cardiologist to exclude the diagnosis of Marfan syndrome. People with ectopia lentis syndrome do not have the heart and blood vessels problems associated with Marfan syndrome. Therefore, it can only be differentiated from Marfan syndrome or emerging Marfan syndrome through ongoing medical follow-up, including frequent echo to ensure that there is no enlargement of the aorta, the large blood vessel that takes blood away from the heart. Treatment. Ectopia lentis syndrome may be treated in several ways. Blurred vision caused by lens dislocation can be corrected with glasses or contact lenses. The use of aphakic or refracting around the lens glasses in combination with atropine sulfate 1% ophthalmic drops to enlarge the pupil serve as an effective alternative to surgery. In severe cases, the lens of the eye may need to be removed every effort should be made to avoid surgery until absolutely necessary to achieve adequate vision because of potential complication of surgery. Artificial lenses can be placed in the eye after lens removal once growth is near complete. How do we underwrite? There are some data to suggest normal life expectancy in best case scenario for people with ectopia lentis syndrome. Patients with dominant ectopia lentis syndrome should have intermittent echo to exclude aortic root enlargement even if this has not been seen in other family members because it can impact life expectancy if it is not treated. Follow your company specifics and underwriting manual to accurately price the risk. Let's take a break here and see you soon. Take care. Bye now.